Hey everyone, it's Dr. James Escaloni from Wellward Regenerative Medicine to tell you a little bit about some tips for your neck. So if you've got a pain in the neck, it doesn't have to be as much of a pain in the neck. Yeah, I went there because we've got some helpful tricks and tips to be able to help you out. Stay tuned. Hey, welcome back. So I wasn't lying to you. We're talking about some pain in the neck to try to help you out today. So pain in the neck. What am I talking about? There's this area from here. It can sometimes go down your arms, and all these parts of the back of your head can cause pain. That's exactly what I'm talking about. Now, to help out, so we understand which areas can cause maybe which pains, I've got my helpful assistant. Helpful assistant, where'd you go? Oh, there he is. Perfectly helpful for me. All right, let's get your neck over here. All right, so he's going to hoverboard his way on over here. This area right from here, if you're having headaches, that may be because of your neck, there's a spot right up here, your first two vertebrae, C0 on 1 and C1 on 2. These two up from here are the areas that are more likely to be a cause of you having neck pain that causes headaches too. Not only on top of that, if you've got a problem from here, it could be because of a loose ligament, because maybe you had a whiplash injury, means these healed loose. It means they're maybe a little bit too wobbly. You would know that because your neck would pop and click a little bit too much, just all the time. Now, when that starts to happen, you might notice more and more tension from here because the rest of the neck is trying to tighten up to try to make this not move so much. You know what makes it worse? There are these suboccipital nerves that are right up in here, right at the back of your head, right above that. They get compressed right underneath that. All of those can cause headaches. Sounds complicated, but it's right up our wheelhouse. We can figure that out to help you out. Now, here's another area that's common for neck pains, right where the thoracic spine is. This is where the ribs are. So if you look up right here, this is where the ribs end and the neck begins. This junction called the cervicothoracic junction is actually where these 2 points come together, and it's where, because this right here is made stiff because of the ribs, and this right here is nice and mobile. Okay, that means this is the spot that gets the most torque on it from all the different motions that you do. And so if that happens, this one can get injured the most. So this is C7 on T1. That's where those two are together. Now, this can have a lot of symptoms associated with it. It can be just right here, very pinpoint, sharp pain. It can start to radiate out in both directions if you sprain some of the ligaments over on the side of this joint that help hold it together. Now, here's another thing that also often happens is just like up here, if this gets extra loose, the muscles tension. Same thing can happen here. And this tension right here can cause all sorts of problems because it can not only cause compression on nerves that give neck pain all the way up onto one side, but it can also make it so that you can have problems in moving your shoulder blade, making your shoulder feel tighter to be able to move on one side. Now, one of the secrets with this is if you have pain that runs down your arm, you think, oh, it has to be a nerve, right? Not necessarily. If you saw any of our videos on sciatica, what that means, there's a lot of different structures that can cause pain to go down your arm. Where's my assistant again? Show him that special number. All right, what number are we talking about? So this is important. If you have pain that's going maybe down your neck, all the way down your arm, and it goes into this little distribution of a 6, see the number 6 that we just created right from there? This is usually coming from your 6th cervical vertebrae, right about there. And so if you're coming in and you've got pain that runs down your arm, well, it's going to be one of our jobs to take a look to see, does this person in fact have a nerve compressed? The likelihood is probably really not. Maybe a little bit irritated, definitely. Compressed, not as common. Right, now, what is it then? If it's coming from that sixth cervical vertebrae, then what often happens is we've got these different joints that are like this. This is your middle of your neck. These right here are these other ligaments. Now what happens with these different ligaments, every time I turn left and right with my head, they kind of swivel, like back and forth, okay? A little bit of side-to-side motion, going like this. Now, what holds this right here? This is your disc, your nucleus. It's stapled on there pretty hard. It's very hard for it to get injured, especially in a lot of early day-to-day things. Now, the things that are more likely injured, more commonly injured, right over here, because they're so mobile. These are your facet joints and some of the interspinous ligaments that hold those things together every time you turn your head and lean this way, back and forth. See? It's a tight ligament that tries to hold this in here. And if something happened, especially like a whiplash injury, those are the big ones, well, those ligaments get yanked on. And here's the thing to think about. Why is it a ligament can hurt any place in your body? Well, what happens with a soccer player who sprains their ankle? They turn their ankle to the side, and a ligament holds it, and then boom, it's injured, torn. But most people don't need surgery for a sprained ankle. We've all had them. And what happens from there? It gets tighter and tighter and tighter with the healing, but doesn't heal completely. So we walk it off and we're fine. What happens to a lot of soccer players? Well, they turn, they get their ankle to a near point, and this ligament, it's supposed to send a signal to the brain that says, foot, you can stop here. And so what happens from there? It sends a signal instead of the safe spot a little bit too far, meaning that person's going to have a re-sprain, and a re-sprain, and a re-sprain because it keeps on happening. And look at this. Now you've got a super loose ligament that makes it so that not only does this hurt more, but it also, the joint's just a little bit sloppy. And that happens everywhere in the body, especially the neck after whiplash associated disorder. So if you have that going on in your neck, then this means that you can have persistent issues, not only locally, going down your arm, giving aches, deep aches, almost identical to a nerve that gets compressed into there. That's a huge deal. So something that just needs to be considered when you're having neck pain is it's generally not squished compressed nerves that's going to be paralyzing you. Generally speaking, no. All right? If it's a little bit higher up in the back of your head, a lot of times these injured ligaments are the source behind a lot of the neck pains and headaches that you feel. If it's a little bit lower down, those same ligament issues can be causing pain that goes down your arm. So what can we do about that? A lot of times, if you go to your physical therapist like me or a good chiropractor, they'll do some hands-on work. They may do a little bit of traction if they find that it relieves it for a little bit, and they'll do some exercises that could strengthen it, try to get the multifidi muscles a little bit stronger. And of course, if they have the ability to do acupuncture or dry needling, that can also be very helpful to decrease muscle tone, decrease nerve pain, all of those things. What happens when you've done that? You're saying, Dr. Escalante, the whole reason I'm watching this video is I've had neck pain. It didn't go away because of that. Now what do I do? Well, this is where Wellward has our specialties. We figure out where exactly are the problems. Through our pain mapping process, we actually figure out exactly the location of the pain. That's where we test out every little suspected area that could be the problem site, and we put a little bit of a numbing agent. So you can say, okay, here's this area at C6, all right, on that left ligament there. Let's test it out and numb it. How is that? Oh, it actually still hurts just the same. Oh, okay, what about the right ligament? Oh, all my pain gone and my left hand feels better now. True story, we see this all the time. And so now we can know exactly where your symptom's coming from. An old sprained ligament on the right side of your neck causing problems on this other side. So then at that point, we can do a lot of the amazing things that we do at Wellward Regenerative Medicine. So if it's something like a prolotherapy injection, ERP, something like bone marrow aspirate concentrate, all of these are orthobiologics that have the ability to tighten up ligaments like that injured one, start to help out with muscles to regenerate, capsules, discs, meniscus, all those things have the capacity and ability to regenerate. Organic components are placed near there. I've had this done to myself many times. All my family members have had this at one point or another. And it can be very, very helpful for these people who've tried conservative therapy and it's just not working anymore. So, thanks for listening this time. What I'd love you to do is to comment, like this, share this, all those things. We always read it. And Dr. Danish is going to be back for the next one. We'll be talking about the different commentary and what we can do to help you guys out. And if you've got any new ideas that you'd like us to talk about, please let us know. We'd love to hear from you. Okay, so from myself and my special guest assistant who's running over here right now as fast as he can, all right, we say thank you for watching. We appreciate y'all very much. Bye.